That's a very timely question. I mentioned a few minutes ago that we opened a choices program, and recently we've benefited from a grant from the state to expand those services. There is the opioid crisis that we have at the moment. We've had 400 people die in the last year in New Hampshire from overdose. Many of those overdoses are opioids that are laced with fentanyl, which is increasing the death rate from overdose. Recently we've had the introduction of Narcan, which is the drug that brings people back from overdose, which has actually prevented many more deaths within New Hampshire. I would say that the state is in a state of crisis at the moment and is responding to that by saying, let's build a continuum of care for people who struggle with drug use. But I don't want to forget alcohol, because alcohol still kills more people than heroin does in this state and in this country. We have a problem, an epidemic at the moment, and that is real. But the issue of alcohol remains a public health issue in this state. And this state, I have to say, has to look at itself and say, we're selling alcohol, we're deriving tax revenue from the sale of liquor. What are we doing with that to support people's recovery? And until we do that, I'm afraid we're going to continue with that along that line with alcohol. And until we actually recognize that there is a prevention piece for drugs and alcohol in schools that doesn't glorify the use of drugs and alcohol, and I'm talking about marijuana here as well, until we have a public policy of prevention, we are going to continue to lose lives too early. With the homeless population, it is much, much higher. I worked for 10 years in Boston with emergency services teams. I worked on the O-Van with the Pine Street Inn as the outreach van, where we delivered healthcare to people who were homeless at night. And I asked a question of Jim O'Connell, who was the head of Boston Healthcare for the Homeless. So how many people are struggling with addiction and mental health that we're going to see tonight? And he looked at me and said, "You idiot, all of them." Slight overstatement, but it is a major problem in terms of that population. And until we can get services to those people, until we can be constructive and think out of the box about service delivery for people with addiction, we'll continue to have people struggle with addiction. The average age of somebody that we dealt with of the chronically homeless population at death is around 42. That is outrageous, and we have to address that.
One of the older statistics that was used to identify the death rate of homeless people used to be, it was always cancer. It was one of the highest death rates. And that was contributed, of course, from the lifestyle, from substance abuse issues, which was mostly alcohol. The opioids, the extensive use of opioids now is really making very, very difficult choices for people and their ability to move forward. It's an enormously severe addiction, and we're addressing the issue with our new centers right now. And hopefully we'll be able to make a quite concerted difference with that population.
One of the evidence-based treatments for people with opioid dependency is medication-assisted therapy. People may have heard of Suboxone and buprenorphine. Those are synthetic drugs that block the effects of opium and mimic them somehow. A little bit like methadone, which is still available, of course. Riverbend, we've opened choices, as I mentioned before, and we are now providing that service, which allows people to detox on an outpatient basis and then be maintained along a continuum to full recovery on these new drugs. And they are really, for a significant part of the population, they work very well. We have to keep up with what's working in the medical community, and we have to respond to that. And I think we're doing that by saying, here we have a crisis around opioids. This is what we need to do. We need to hire staff. Workforce is an issue in this state. We are an aging state. Many of our young people who are enthused and interested in going into behavioral health services are drifting south. We have to stop that. We have to make New Hampshire a place where people want to come and work and stay and play, as they say in STEM. The same thing is relevant for behavioral health services and medical services as well. And that requires a statewide